class, this is Kelly Neal, and today we're going to be looking at oxygen needs, chapter 39. So we have discussed this chapter some before in the past when we were looking at oxygen tubing, but now we're going to talk about oxygen in a little bit more detail. So when we're thinking about what oxygen is it's a gas. There's no taste, odor, or color to it. It's required for life. And death occurs if our breathing does stop. So if a person quits breathing and we don't start breathing for them, of course, the heart's going to stop as well, just from lack of air going to it. So if we did have to do rescue breathing, if a person quit breathing and their heart was still beating, we would do rescue breathing. And rescue breathing, we do one breath every 5 seconds for an adult, 5 to 6 seconds for an adult, and one every 3 to 5 seconds for a child. That's saying they had a pulse, they just weren't breathing. If we don't do this for them, so they've stopped breathing and we don't start breathing for them, brain damage is going to start without oxygen. Within 4 to 6 minutes, irreversible brain damage starts if we don't start breathing for someone. Now, oxygen actually is only about a 21% concentration in room air. So the air that we're breathing in, it has 21% oxygenation. It also has CO2. It has other gases that are out there. And so a lot of people will ask me, well, if we're breathing in a 21% concentration of oxygen and we exhale our CO2 out, how about when we do rescue breathing? If someone needed rescue breathing and we needed to breathe for them because we didn't have advanced airway devices like we do at the hospital, how would that even help them? And the thing you need to realize is even though the room air is 21% concentration of oxygen, our exhaled air still has 15 to 16% oxygen, even in that exhaled air. So our respiratory system, it starts, we breathe in air through our nose or through our mouth. It comes to the back of our throat, our pharynx, down the trachea, and then it goes down the bronchial tubes into the lungs. Now, in the lungs, the air comes all the way down to our air sacs called the alveoli. And the alveoli has a diffuse network of cardiovascular network that surrounds the outside of the alveoli, arteries and veins. And this is where the oxygen and CO2 concentration is going to change. So when you take in air, you breathe in air through your mouth or nose, comes down into your lungs, into these alveoli, and your heart sends the blood supply over to the lungs, and it surrounds these alveoli sacs, and through osmosis and diffusion, that oxygen you breathe in is going to go into the blood supply to be carried back to the heart, to be pumped to the entire body, and your waste products, your CO2, you're going to exhale off. Now, things that are going to affect this. Well, one is your respiratory status. Are your lungs working properly? Does your respiratory, is the entire respiratory center working okay? Is your circulatory system okay? Okay, your heart has to be pumping blood and getting blood over to the lungs for that to be happening as well. We have to have an adequate red blood cell count because remember, our red blood cells is what binds with our oxygen. The hemoglobin in red blood cells is what binds with the oxygen to carry that blood to the tissues and to the body where it's needed. The nervous system, okay, in your brain stem, you actually have, your centers that are going to control your breathing. And so our nervous system has to be working properly for breathing to take place and for our oxygen needs to be met. As we get older, of course, some of these things can be impacted. As we get older, we've talked about how the lungs lose a lot of their elasticity, our strength of coughing decreases, our circulatory system. A lot of times we have vascular issues and high blood pressure issues that sometimes that can impact the circulatory system. Exercise. When you exercise, of course, it's going to increase your oxygen your oxygen needs with exercise because you're trying to get more blood and oxygen to the tissues. Fever, okay, when a person is running a fever and they have that increased temperature, that again will also increase oxygen demands. Pain levels. So when a person has pain, a lot of times they will increase their oxygen consumption a little bit quicker, mainly because of anxiety and discomfort. And then medications can impact our oxygen needs as well. So certain medications, especially our narcotics, can actually cause what we call respiratory depression, where it slows our breathing down, where we are not taking adequate breaths and our volume of our breaths is not adequate. And if you have enough narcotics on board, it can cause respiratory arrest, which can actually make you stop breathing altogether. Other things that can impact your oxygen needs, smoking. Okay, I mean, when we smoke, you're taking in carbon dioxide, you're taking in, a lot of chemicals in there, and your lung capacity, your hemoglobin actually has an affinity to bind with these things instead of the oxygen. So you don't bind with as much oxygen when you're a smoker, and you don't circulate as much oxygen to the body. Allergies. An allergy is a sensitivity to a substance, okay, and that can impact your ability of how well you're going to use up your oxygen demands and how well you're going to be able to take in enough oxygen. Pollutant exposures, nutrition. We've talked about nutrition, how important iron is, for instance. Iron is needed to actually make hemoglobin, and hemoglobin is needed to bind with oxygen. So good, proper nutrition is really important as well. And then alcohol can actually depress the respiratory center as well and can impact our oxygen needs. So respiratory function, our air is going to move in and out of the lungs. Oxygen and CO2 are going to be exchanged at that alveoli level, and the blood is going to carry oxygen to the cells and remove the CO2 from them. So the term hypoxia, and it is a term that we've talked about before in a previous class, but it is something that I really want you to understand. I think it's extremely important as a CNA to understand the concepts of hypoxia, because I believe as a CNA, because you have the most contact with the patient or the resident, depending on what area you're working in, a lot of times you're going to notice these symptoms first, and recognizing them for what they are is very important. So hypoxia means not enough oxygen to the tissues or to the cells. So the cells do not get enough oxygen supply. When a person is not getting enough oxygen throughout the body to the tissues, there are certain signs and symptoms that we're going to see. And remember, a sign is objective data, what we're seeing. Symptoms are subjective data, what the person's complaining of. And some of the signs and symptoms we'll see is restlessness or anxiety. If you aren't getting as much oxygen to the tissues of your brain, you might become anxious, really restless, not really, almost fidgety, not really sure what's going on. People will start noticing behavior changes in the behavior that you're presenting, and you might actually be disoriented, where you're not fully aware of everything that's happening and you're starting to become confused. Some people will have dizziness with this as well. Other things that we notice is fatigue. If you're not getting enough oxygen throughout your body, throughout the tissues, you're going to feel tired. Okay, you're just going to feel really tired and run down. Fast heart rate. So when a person is not getting enough oxygen, the respiratory rate usually goes up. You have increased respirations, which is known as tachypnea, but you will also have a fast heart rate, tachycardia. Because what happens is your heart realizes it's not getting enough oxygen and pumping enough oxygen everywhere. So what it does have, the heart rate speeds up to try to compensate for that, to try to get what it does have throughout the body. Unfortunately, that uses up your oxygen of the heart even faster, so it almost compounds the problem. Cyanosis, that's that bluish color around the lips and the nail beds, and you really tend to see it in the lips first, around the mucous membranes of the mouth, but in those nail beds as well, you'll just notice a slight bluish tinge to it. And dyspnea. Remember, dyspnea, DYS, is the root word for difficult, and PNEA, pnea, is the root word for breathing, so difficulty breathing. Now, if you see signs of this, so you're taking care of your resident And they've been fine. They have been absolutely fine. And now they're showing they're dizzy, they're anxious. Maybe they're a little bit confused. Their heart rate's going up. Their respiratory rate looks like it's going up. We would want to make sure we report that to the nurse right away. Now, if we're looking at this patient and we're saying, okay, this person's had a history of confusion before, maybe they're a dementia patient, and we're starting to see that, their confusion is increasing. Well, if you see other signs, you're seeing the heart rate's going up, the respirations are going up, they seem like their breathing is a little bit more labored. We want to make sure we report it to the nurse. The other thing we can do if we're concerned about hypoxia is we can get an oxygen saturation value. We can put that SpO2 monitor on the finger and just get a quick reading and see, what it is, if they are getting enough oxygen to those tissues. Okay, and that's a really nice, quick, easy tool. So when you're looking at this and you're saying, okay, my patient has issues with confusion. Maybe this is just their normal routine, okay, and I'm not noticing any other signs. Just do a quick oxygen saturation. But if this is something new, anytime you have confusion, disorientation, behavior changes, and that is something new for the patient, they have no history of dementia, no history of Alzheimer's, you always want to make sure you report it to the nurse because it can be extremely critical. So there are some terms for abnormal respirations that I want you to learn. One is tachypnea. Okay, that's that rapid breathing or fast rate. And remember, our normal respiratory rate is 12 to 20. So we're talking about a rate over 20. The term hypoxia, I told you, was not enough oxygen to the cells. So hypoxemia is a reduced amount of oxygen in the blood. Bradypnea, brady means slow, so we're talking about slow breathing, less than 12. Apnea, A in front of a word we said was absent or lack of, so lack of breathing. Dyspnea is difficulty or labored breathing, so they will just look short of breath. They will look like they're struggling to breathe. You might see them, where they look almost air hungry or like they're using their muscles of their chest to try to pull in air. And orthopnea is only able to breathe comfortably when they're actually in a sitting up position. So they're laying back in bed, they just can't get their breath. You have to sit them up for them to actually be able to breathe normally. So this pulse oximetry is a really quick, simple way to just check oxygenation levels. So it just clips onto the finger, and for babies they make them where they're built into their little caps, and they also make some that attach to the earlobes. So if you have someone who's picking at their, they don't leave the device alone on their finger or something, you can actually do one on the earlobe. But usually we can just clip it on the finger and we get a quick reading. It'll tell you the oxygen saturation value and it will give you the heart rate. Now, the thing I want you to realize about this is a normal oxygen saturation is 95 to 100. That's the value that your book uses, is 95 to 100. Some places of employment use 94 to 100, but 94, 95, either way, I'm good with it. That's generally what you're going to want to see with your oxygen saturation in that range of that 94 to 100. So let's say my oxygen saturation is only reading at 88. But my heart rate isn't reading correctly. So for instance, let's say you took their pulse and you got a rate of 100 for their pulse. And now you hook them up to the O2 sat machine and it's giving you an oxygen saturation value of 88, but it's telling you your pulse is only 60 or 70. It is not picking up something correctly. One of the ways you know if this is reading it correctly is this pulse rate right here, is it about the value of what you got? It doesn't have to be the exact number, but if you're getting 100, I would expect this to be picking up between 95 to 105, at the time I'm doing this. If it's picking up something completely different, then I know it's probably not an accurate reading. It's not probably picking it up correctly. Now, the other thing with the pulse oximeter is you don't have to have an order to do this. If you're concerned about their oxygenation, one, you always want to make sure you tell the nurse, but if you're concerned about oxygenation, just get an oxygen saturation reading. It's non-invasive. You don't have to have the nurse's order or a doctor's order to be able to do it. You can do this at any time. So we are going to stop here and we will continue with part 2 of our lecture in just a moment.